Namaskar dosto, good evening friends. I am Dr. Sanjay Kalra, your friendly and familiar endocrinologist, and you are watching Dr. KK's Med Talks. Mondays with Dr. संजय कालरा के हमारे नॉन स्टॉप शो का ये 1109वां 1109वां एपिसोड है 1109th एपिसोड. Let's have the headlines for the day. Now, several studies have identified a relationship between depression, suicidal tendencies, and obesity. तो मोटापा, आत्मघात करने की इच्छा और उदासी या डिप्रेशन ये सब लिंक्ड हैं. Scientific data has also revealed that men with obesity, जो आदमी हैं जो मोटापे से ग्रस्त हैं, they may experience memory decline. उनकी याददाश्त कम हो जाती है a decade earlier than women. तब भी मैं सोचूं मेरी याददाश्त क्यों कम हो रही है. Now I realized. So men experience memory decline a decade earlier than women. याददाश्त कम हो जाती है and this is because of inflammation. सूजन जो होती है एंड ब्रेन एट्रोफी, दिमाग सुकड़ जाता है एंड दिस हैपेंस इन ओबेसिटी. तो ये भी एक पैराडॉक्स है. एक तरफ तो मोटापा है, दूसरी तरफ जो आपका दिमाग है उसमें सुकड़न है. ओबेसिटी इंड्यूस्ड गट डिसबायोसिस, जो हमारी आंतड़ियां हैं या जो हमारा पेट है जिसमें बैक्टीरिया रहते हैं वो बदल जाते हैं ओबेसिटी में, मोटापे पे. एंड दिस ऑल्टर्स ब्रेन सिग्नलिंग एंड प्रमोट्स न्यूरो इन्फ्लेमेशन. तो जो बैक्टीरिया, जो जीव जंतु हमारे पेट में रहते हैं वो भी बदल जाते हैं मोटापे में, और वो जो मैसेजेस भेजते हैं हमारे ब्रेन को, उससे ब्रेन में सूजन हो जाती है एंड दैट इन्फ्लुएंसेस आवर मूड एंड आवर बिहेवियर. हमारे विचार और हमारा जो हमारे व्याकुलता है हमारी, उस पर इम्पैक्ट पड़ता है. रिड्यूस्ड ग्रे मैटर इन एरियाज लाइक द हिप्पोकैम्पस एंड फ्रंटल लोब, ये हिस्से हैं हमारे ब्रेन के. दीज आर ऑल्सो ऑब्जर्व्ड इन इंडिविजुअल्स लिविंग विद ओबेसिटी एंड डिप्रेशन. तो ओबेसिटी में भी और डिप्रेशन में भी दिमाग के कुछ एक हिस्से जैसे फ्रंटल लोब या हिप्पोकैम्पस, वहाँ का ग्रे मैटर हल्का हो जाता है. अकॉर्डिंग टू अ रीसेंट स्टडी, वेट रिडक्शन वाया बैरियाट्रिक सर्जरी, जो ऑपरेशन होते हैं वेट कम करने के लिए, और GLP-1 RA थेरेपी और लाइफस्टाइल चेंजेस, चाहे जिस मर्जी तरीके से आप वेट कम करें, दिस हैज बीन एसोसिएटेड विद इम्प्रूव्ड कॉग्निटिव फंक्शन इन अप टू 40% ऑफ पेशेंट्स. आपकी याददाश्त, चुस्ती फुर्ती, दिमाग की तरोताजगी ये बेटर होती है अगर आप वजन कम कर लेते हैं. नाउ विद दीज हेडलाइंस लेट्स गो टू आवर टॉपिक फॉर टुडे. आज का टॉपिक देखते हैं क्या है. Our topic is neuropsychiatric aspects of obesity. So this is a very important topic. Obesity तो हम जानते ही हैं क्या है. Neuropsychiatric aspects क्या हैं? Let's see what these are. And a warm welcome to our expert speaker today, Dr. Souvik Dubey. Warm welcome, sir.
Good evening, sir, and thank you very much for inviting me in this talk.
Well, the gratitude and the thanks is from our side, Dr. Dubey. Dr. Souvik is an associate professor in the Department of Neuromedicine at the Bangalore Institute of Neurosciences in IGPGMR, Kolkata. This is one of the most prestigious medical colleges of the country and South Asia. Dr. Dubey brings a unique approach to the concept of neuromedicine. Not only does he have expertise in neurology, but also in psychology and psychiatry. And we will find when you speak with him, डॉक्टर साहब की जो नॉलेज है, डॉक्टर साहब की एक्सपर्टीज है, जो तरबियत है, वो अकेले साइंस या मेडिसिन की नहीं है. जीवन शैली का या लाइफ का, फलसफे का, फिलॉसफी का कुछ भी आप हिस्सा पूछ लें तो डॉक्टर दुबे वाकई उसमें एक्सपर्ट है. इनकी जो साइटेशंस हैं, मोर देन 5000 साइटेशंस ऑफ हिज आर्टिकल्स, दैट इज एक कहावत मुझे याद है, डॉक्टर सोविक, आई रिमेंबर एन एडवर्टाइजमेंट फ्रॉम लॉन्ग अगो, ओनर्स नेबर्स एनवी एंड ओनर्स प्राइड. सो दैट इज व्हाट योर साइटेशन इंडेक्स इज लाइक. बट
Sir,
अब हमारी प्राइड
sir, sir, it's all what I am trying only, sir, only to make it simplify those things in neuropsychiatric basis of any disease, and I try to extrapolate it in human day-to-day life so that we can mitigate some sort of sufferings by modulation of brain modulation and other simpler things that may obviate the need for the costlier medicines and like that, sir. This is my only aim.
Thank you,
That
sir.
if
This
you
is
can
very
modify.
important. Yeah. This is actually the aim of KK Med Talks as well. In KK Med Talks, we try to simplify medicine. We try to simplify the concepts of medicine so that we can all remain healthy. And people logged in from throughout the country greeting you. रामजी
Thank you.
अग्रवाल साहब आपको नमस्कार कर रहे हैं and adab from Uzair Anwar Sahab. Akshay Devan says a hi to you, and also Ali Nazakat Sahab saying an adab, and then Vinayak Sharma saying good evening. And the question from
Good.
everyone is, sir, neuropsychiatry. The word itself is so scary. We feel afraid when we hear the word neuropsychiatry. What does this mean?
Sir, exactly. Uh, there is a unknown struggle between neurology and psychiatry. The unknown struggle why people from neurology field criticize psychiatrists and from psychiatry part criticize neurologist. But in my sense, that both of us, neurologist and psychiatrist as well, basically we are dealing with a same organ, that is brain, human brain. And what actually the structural concepts of brain goes in favor of neurology, and the other aspect, the suprastructural aspects which we cannot see in brain imaging or like that, that goes in favor of psychiatry. So I believe in some neuropsychiatric cubism. That means that we should see brain from holistic point of view, so that the networks, the neurotransmitter, and our brain act as a unifying organ. So the expression of the diseases which affect our brain have the similar manifestation. So it may be from neurological point of view, it may be from psychiatric point of view, but the presentation will be same, sir. That's why I think neuropsychiatry should be the better term to depict any sort of neuropsychological problem or
What we
brain
are
problem,
hearing from
and
Dr.
it will be more
Suvik is,
holistic, sir.
it reminds me of the Yeah, what you're saying, Professor Dubey, that reminds me of the Rig Veda, which says that the truth is one, but the paths to it are many. And then from Jainism, in Jainism, there are three pillars of faith, and one of them is Anekantvad, which means respect for plurality, for multiplicity of ideas. So,
Right, sir. That is inclusivity. Inclusivity. We should be
yeah.
inclusive, sir. Yes, sir.
So, what
We
is
should be
happening
inclusive.
in
And
today's world? What is happening in today's world, Dr. Dubey, the world at large and the medical field at large? Is it true that if I have read a particular textbook, then that is science, but if I have not read the textbook and you've read it, then that is quackery? Is that how we are behaving these days?
yeah, sir. Yeah. The basic problem is with our knowledge, sir. Basic problem is with our knowledge. What I am not knowing. And if anyone tells like that, or if anyone can imagine that part, and if I am not, then I'm simply saying that it is quackery. But this is basically my limitation of knowledge, which actually triggers those sort of thinking, sir. But we should not express that sort of thinking that actually express our poverty of thought, sir. Which I believe we should be more holistic, we should be more compassionate, we should be more empathetic, and we should be more inclusive in our subspecialty domains as well as towards our patient. Otherwise, if we don't have patience while treating patients, then it will be of disaster, and the ultimate fate will be that we will be dependent on the machine, and in huge way the artificial intelligence will come in future, and ultimately what happened that our empathy will be snatched by the machines, and they will treat us by just maintaining the algorithm, which will be a disaster for human being in my sense. That will obviously of help, sir, that no doubt that some sort of algorithm definitely will help in making the diagnosis, but the empathetic touch which we can work, sir, it's in real doubt whether the AI machines and others, if we become machinery and starts blaming each other, then for the purpose they will serve, it's of great controversy, sir, in my sense. What do you think, sir? What is your take on this?
बिल्कुल सही कहा डॉक्टर दुबे ने। डॉक्टर दुबे जो हमें कह रहे हैं, एक तो नम्रता चाहिए, दैट इज कंपैशन, एंड दूसरा ह्यूमिलिटी, घमंड से बचें। सो इफ यू नो समथिंग, यू हैव अ राइट टू बी proud of that. You have a right to feel that yes, I do know my subject, but at the same time you should not look down upon other sciences. Sir, we have many questions
Right,
for
sir.
you. Let's take one question before we move on with the topic. So, Akshay Divanji, he's a young, handsome boy who has very successfully fought obesity. Now, his complaint is, I experience fasciculations all over the body. तो पहले तो पूछेंगे सवाल अक्षय जी को भी एंड डॉक्टर दुबे को व्हाट डज द वर्ड fasciculation मीन. Akshay ji says, I experience fasciculations all over the body, palpitations, high heart rate, एंजाइटी मुझे डर लगता है. आई वॉज ऑन एंजाइटी मेडिसिन when my weight went up and then I got hypothyroidism also. Now all these things are in range, the weight, the thyroid, all are okay. So are these all correlated? And उनका ये सवाल है, should I consult a psychiatrist or a neurologist or a neuropsychiatrist, uh, neurologist, whom should I consult इन सब चीजों के लिए?
Sir, one thing is that fasciculation means abnormal twitching over the muscles. Abnormal twitching over the muscles. But that abnormal twitching or fasciculation is not disease specific if it happens in normal muscles. But if muscles are wasted, then sir, fasciculation is only significant for disease perspective. However, whatever gentleman or young boy is complaining that he have fasciculation, he have palpitation, and he used to take some sort of anti-anxiety medication. In my sense, that after losing weight or successfully fought against the obesity, after there may be some sort of anxious rumination inside in the mind of basically comes out from the inner thinking that uh, I may be obese again. And I think these fasciculations are benign, sir, nothing to worry. And for this, it's likely that it would be better for him to consult one psychiatrist rather than neurologist and endocrinologist. However, from hypothyroid point of view, and as it was associated with other metabolic metabolic profile derangement, so psychiatrist and endocrinologist combination will be good for him, sir, in my sense.
So thank you डॉक्टर दुबे एंड अक्षय. सो द आंसर इज कि ये बिनाइन है. बिनाइन मतलब कोई कुछ उल्टा पुल्टा या कोई बड़ी बीमारी नहीं है. एंड जो वर्ड डॉक्टर साहब ने यूज किया एंग्शियस रूमिनेशन, इट मीन्स हम बार बार सोच रहे हैं. अब कोई भी तकलीफ हो, कोई भी परेशानी हो तो सोचना जायज है. इफ यू डोंट थिंक, विचार नहीं आएंगे तो आप एक्शन कैसे लेंगे, कार्य में कैसे जाएंगे. पर एंग्शियस रूमिनेशन मतलब बार बार एक ही चीज के बारे में सोचना. एंड डॉक्टर साहब ने ये भी पिन पॉइंट किया, वन ऑफ द etiologies, वन ऑफ द रीजंस माइट बी that you are worried that you might lose weight, you might gain weight again, or you might become
Right.
hypothyroid again. तो एक साइकोलॉजिस्ट या साइकाइट्रिस्ट की मदद लेके एक्चुअली बहुत फायदा मिलेगा आपको. एंड अक्षय ऑल्सो सेज एनी ऑल्टरनेटिव टू गेट ऑफ दिस सिचुएशन विदाउट लॉन्ग टर्म मेडिसिन. वो आई गेस साइकाइट्रिस्ट विल बी द बेस्ट पर्सन टू डिसाइड.
Exactly. However, sir, for him it would be very helpful if he practices the meditation, if he practices relaxation therapy. That means we have, sir, in our brain one default mode network. This is very important. That default mode network means that represents the inner calmness of our brain, and that also points towards the introspection of our mind. And studies showed that the unrest DMN usually creates a lot of ripples in the brain that may create anxiety, that may lead to anxious rumination of thoughts. And in that way, to calm down our DMN, that unrest DMN, meditation and relaxation therapy would be of much help in case of anxiety instead of long-term medication therapy. That may help him.
सो लेट्स ट्राई दैट अक्षय एंड लेट अस नो नेक्स्ट टाइम कि फायदा हुआ कि नहीं हुआ मेडिटेशन और रिलैक्सेशन से. इसकी भी एक्सपर्टीज होती है, तो अलग अलग तरह के लोग होंगे. ही विल हेल्प यू फाइंड द राइट पर्सन टू हेल्प यू आउट. Some people focus on religiosity, others focus on spirituality. तो कोई धार्मिकता पे और या मजहबियत पे, और कोई रूहानियत पे या आध्यात्मिकता पे. सो दीज आर डिफरेंट वर्ड्स एंड डिफरेंट कॉन्सेप्ट्स. सो सी वट एवर सूट्स यू
Exactly.
बेस्ट. या Dr. Souvik, there's a
Yes.
greeting for you from Dr. Shashi Khare as well as from Aditya Panu, who is another smart, handsome boy from Haryana. Aditya आपको पूछते हैं कि sir, everybody says that obesity is an endocrine disease or a metabolic disease. But would this be right to say, and अभी हमने बात की थी अनेकांतवाद की from Jainism, all things put together, multiplicity of ideas, plurality of ideas. So this statement, obesity is a neuropsychiatric disease. Would this be accurate?
Sir, not necessarily, because sir, obesity basically is a metabolic problem. However, if neuropsychiatric part is indirectly, or what you said in your opening lecture, that it's bidirectional relationship. That means, let me explain, sir. That means if I have obesity, then one thing that goes inside in my mind, that I may lose my self-esteem. I may have poor confidence, and I may have a heavy meal. After that, I start feeling guilty, or after that, I start feeling I'm not doing right now. So that's why there is a continuous debate or continuous unrest in mind is going. That's what is happening. That is known as cognitive dissonance. That if I am taking a heavy meal, then I think there is fear of gaining weight, and then I start. Some people do it, sir. Some people do inside. They put their fingers inside the mouth and they do vomit. And by the way, they think that the food will come out from the stomach and that will help in gaining weight. That will help in mitigating the weight. But these are the another spectrum of eating disorder. And in depression, sir, most important thing is that in depression, usually people lose weight. But there is some sort of depression or known as atypical depression. There, people start taking much food, much more food, even in excess for the need, and that will cause gain in further weight. So in my sense, that it starts from the metabolic derangement. Later it will cross talk with the brain networks and will ultimately it lead to cognitive dissonance, and from dissonance again that make a vicious cycle, eating disorder, and then again atypical depression, or like that thing. So I think that obesity has two ends, sir. It one end it captures depression and anxiety, and other end it captures eating problem and in abnormal metabolic milieu. So obesity basically tried on a pivot, and that pivot that tried the pivot basically made up of metabolic derangement, some depression, anxiety, and some eating problem inside. So these are the uh, basically a multiple disease of multiple organ system. It's not just metabolic derangement or neuropsychiatric problems, and one influence other.
Yeah, apologies, I got disconnected. So
हाँ सर
डॉक्टर
सर
सोविक वेल टेकन। तो जो डॉक्टर साहब कह रहे हैं, जो जड़ है, जो जमीन है ओबेसिटी की, द सॉइल और द रूट कॉज ऑफ ओबेसिटी इज मेटाबॉलिक। मेटाबॉलिक डिजीज है या एंडोक्राइन डिजीज है। पर एक बार ये शुरू हो जाए तो उसके बाद दिमाग पे या हमारे सोचने के तरीके पे इम्पैक्ट पड़ता है। कॉग्निटिव डिसोनेंस मतलब जो हमारा सोचने का तरीका है वो आपस में मेल नहीं खाता। अब ये भी हमारी पुरानी सभ्यता है, इंडियन फिलॉसफी, इंडियन भारतीय फलसफा ये कहता है कि इफ योर थॉट्स, योर वर्ड्स एंड योर एक्शंस आर इन कंकॉर्डेंस विद ईच अदर, आपके जो विचार हैं या जो सोचते हैं, आपके अल्फाज या जो आपकी बोली है और आपके कार्य या कर्म है, ये एक साथ चलते हैं तो दैट इज कंकॉर्डेंस और कॉन्सोनेंस। यदि ये अलग हो जाए, आप सोच रहे हैं कि मैं पतला होना चाहता हूँ, आप बोल रहे हैं कि समोसे बहुत स्वाद हैं, और खाने के टाइम पे आपने रसमलाई खा ली या रसगुल्ला खा लिया, वेस्ट बंगाल का, कलकत्ता का मशहूर रसगुल्ला खा लिया, और एक नहीं दो नहीं चार खा लिए, दैट इज डिसोनेंस, दैट इज डिस्कॉर्डेंस। उसके बाद आप
एग्जैक्टली
उदास हो जाते हैं कि मेरे से गलती हो गई, फिर आप कोशिश करते हैं उल्टी करने की या कुछ और करने की, फिर आप 12 घंटे या 14 घंटे व्रत पे चल जाते हैं कि अब मैं कभी भी रसगुल्ले नहीं खाऊंगा। पर 14 घंटे के बाद इतनी भूख लगती है कि देन ठीक है, रसगुल्ले नहीं खाए पर आपने 6 मुर्गी खा ली, वो आप आधा किलो खा जाते हैं। सो दिस इज ऑल डिसोनेंस, दिस इज कॉग्निटिव डिसोनेंस, एंड ऑल्सो अ डिसोनेंस बिटवीन थॉट्स, वर्ड्स एंड एक्शन। सर, कंटिन्यूइंग विद दिस, आदित्य पन्नू पूछते हैं कि आप न्यूरोलॉजिस्ट हैं तो कैन यू हेल्प मी विद समथिंग एल्स। पहले मुझे डायबिटीज थी, ही इज 18 years old, ही हैज बीन एबल टू गो इनटू रिमिशन वेरी सक्सेसफुली। अब जो मेरे एंडोक्रिनोलॉजिस्ट हैं मुझे कहते हैं कि आपकी शुगर लो होती है बीच बीच में, इवन दो आई एम नॉट टेकिंग एनी मेडिसिन नाउ फॉर डायबिटीज, बट आई हैव हेडेक व्हेन आई वेक अप। तो जब मैं उठता हूँ मुझे हेडेक होती है, खाना खा के मैं ठीक हो जाता हूँ। व्हाट कैन बी द पॉसिबल कॉजेस?
Sir, this is something which should be looked carefully, because early morning headache, just headache of just after awakening from sleep, that may be an early indication for a nighttime hypoglycemia. That's why nighttime, or particularly around 4 a.m. to in between 4 to 6 a.m., sugar CBG checking, that means sugar checking at night time, is very much essential, and to see whether he's hypoglycemic or not at night, sir. This is very important sign of hypoglycemic headache. That may not be related with neurology, but hypoglycemia to be ruled out.
हम्म। तो आदित्य, हो सकता है शुगर लो हो रही हो। कई बार ये भी होता है कि जब हम खून में शुगर चेक करते हैं वो नॉर्मल आती है, पर यदि हमारे पास तरीका होता कोई दिमाग के अंदर जाके शुगर चेक करने का, वो कम आती। वैसे भी मान लो ब्लड में शुगर 100 के करीब है तो दिमाग के अंदर 60 या 70 ही होती है, वैसे भी कम होती है। हो सकता है हमारी कम हो, तो उस टाइम पे आप कोई फल फ्रूट खा के देखें और देखें आपकी सरदर्द गायब होती है कि नहीं। जैसे डॉक्टर साहब ने कहा शुगर लो हो सकती है, आसान तरीके से बताएंगे। सो लेट मी स्पीक इन हिंदी एंड इंग्लिश बोथ। इट इज़ पॉसिबल कि आपकी हेडेक है क्योंकि आपके दिमाग में कोई जहर है। वो जहर जो है वो कोई शारीरिक या स्ट्रक्चरल जहर हो सकता है, जैसे कोई ट्यूमर हो, कुछ हो, पर बहुत कम लोग होंगे ना, करोड़ों में एक होगा जिसको ऐसे दिक्कत होगी। दूसरा जहर हो सकता है कि आपका लिवर किडनी काम नहीं कर रहा, तो शरीर को जो जहर निकालना है लिवर या किडनी से, टॉयलेट के रास्ते या बाथरूम के रास्ते से वो नहीं निकल रहा है, इसलिए वो जहर दिमाग को चढ़ता है। ये भी ज्यादा कॉमन नहीं है बीमारी। ज्यादातर क्या होता है कि जैसे आप गाड़ी चला रहे हैं, गाड़ी में पेट्रोल, डीजल, मोबिलाइल, केरोसिन कम हो गया, ईंधन सीएनजी कम हो गई, तो गाड़ी नहीं चलेगी, खड़खड़ की आवाज आएगी। ऐसे ही आपके दिमाग में अगर चीनी, नमक, पानी या ऑक्सीजन की कमी हो तो सरदर्द हो सकती है। आपका सर या आपका दिमाग आपको संदेशा भेज रहा है कि मेरी मदद करो, पेट्रोल डीजल भर दो मुझ में। सो शुगर, सॉल्ट, वाटर, मतलब डिहाइड्रेशन, एंड ऑक्सीजन। हो सकता है आप बंद कमरे में सोए हों, आपने एसी चला दिया, सारे खिड़कियां बंद कर दी, या सर्दियों में आपने हीटर चला लिया, ऑक्सीजन खत्म हो गई आपके कमरे में। या आपका हीमोग्लोबिन कम है। जब लाल कोशिकाएं कम है तो खून ही नहीं पहुंच रहा दिमाग तक, तो ऑक्सीजन कैसे पहुंचेगी? सो लुक फॉर दीज रीजंस, एंड द कॉमनेस्ट, लाइक डॉक्टर सोविक सेड, would be sugar loss. Dr. Sovik, how common is heat exhaustion in the summer in India, and can heat exhaustion present with headache? So, like Aditya is a very busy boy. He has to travel 40 kilometers going and coming
Sir,
from his tuitions.
sir, that might be one of the most important cause, sir. That might be one of the most important cause. Heat exhaustion. That may cause intense headache, and just after taking rest and get himself proper hydrated, then the headache will go off, sir.
सो वील अब हीट तो हम बदल नहीं सकते आदित्य इंडिया की, तो बट अपना ख्याल रखो एंड स्टे वेल हाइड्रेटेड। Yeah. Dr. Yogesh, thanking you, Dr. Sovik, for a very good explanation. And Dr. Yogesh Uplenchar is a physician. Akshay Devan says that my cognitive function isn't the same, and he feels that the psychiatrist will put him on long-term medicines. But then BP high tha. So, Dr. Sovik, in general, for Akshay and for everybody else, should we view psychiatry as a villain, or should we view psychiatrists as friends in white coats?
Sir, definitely, man, we should take it as our friends, because there are lots of problems, sir, which are not so much emphasized in our day-to-day life, but needs to be focused, sir. Needs to be focused, and basically there is a stigma regarding psychiatric diseases, psychological problems, but we have to come out those stigmas, and we should have a free mind to take opinion from our psychiatrist friend and psychologist friends when this is necessary, because some problems are basically the headache, what you told, sir. The commonest cause of headache in India, in sharp contrast from the western countries, is TT headache, that is tension type headache. But people, neurologists, most often we stamp it as migraine sort of headache, and that is most common in western country but not in India, sir. So this is TT headache. Number second, sir, in my experience in working in most busiest hospital in eastern India, that lots of patients, almost 40 to 45% of the patients, basically they are coming in neurology OPD with problem of multiple areas pain, like low back pain, shoulder pain, and neck pain. And even after a lot of investigation and clinical checkup, we cannot find any sort of organicity or organic causes behind it, and we may stamp it as somatization or somatoform problem. And this sort of pain symptoms, mask depression, tension type headache, these are very common, sir. And actually, because these are a lot of stigma to take opinion from the psychiatrist, so we should come out from those stigmas, and I should keep the stigma side and should take help from the psychiatrist and from our psychologist friends, sir. This will actually help us, not putting us in distress or trouble, sir. One thing people usually get afraid that whether I have to continue the medication, psychotropic medications lifelong. That is definitely an issue. But sir, if we take medication for a particular span of period or some definitive interval, then it will be of much help rather than distress, sir. But that should be monitored. The therapy must be monitored every 2 to 3 months, because long-term psychotropic medication may cause changes in brain modulation, as well as that may change in neurotransmitter level as well. So harmful later on, particularly long-term benzodiazepines use or long-term D2 blocker use. Particularly long-term benzodiazepines use may be associated with dementia later on, and long-term D2 blocker use that may cause Parkinson disease later on. That's why we should be a little more cautious, but we needn't to be afraid of taking help from our psychiatrist friends.
It's for help. So speaking to everyone, अक्षय and all of us, अब डॉक्टर सोविक एनक पहनते हैं, मैं भी पहनता हूँ, तो एनक हमारी मदद के लिए है. Dr. Dubey and I, we would feel sick or we would feel unhealthy if we did not have spectacles. Wearing spectacles, it makes us healthy. Similarly, let us say कोई chemical की कमी है brain में, there is some chemical which is present in less quantity, maybe serotonin. Yeah, some chemical which is present in too much quantity and you don't want it, a bad chemical which is present in too much quantity, you don't want that. ये जो psychiatry की दवाइयाँ हैं, they change the balance of these chemicals and they help you have a more balanced life. Sir, continuing with the discussion, हमारा टॉपिक है न्यूरोसाइकेट्रिक मैनिफेस्टेशंस ऑफ ओबेसिटी. तो ये तो आपने कह दिया कि प्राइमरीली एक्सोजिनस ओबेसिटी इज अ मेटाबॉलिक डिजीज. There may be some diseases, some neurological diseases which are associated with obesity. हम इसको अपनी भाषा में बोलते हैं syndromic obesity. Not very common, but would you like to describe some kind of syndromic obesity that you see in neurology? मरीज आता है आपके ओपीडी में very obese and you know, okay, हाँ, this is that particular type of syndrome. Now I know the diagnosis.
Sir, exactly what we are seeing, what we are observing, that in younger age group particularly, in younger age group, young guys with obesity most have some sort of intellectual disability. They might have problem in during the birth events, some adverse birth events, or HI, hypoxic ischemic encephalopathy sequel, or like that. And patient, almost obesity is associated with almost 40 to 50% of patients, young children, obesity is associated with intellectual disability. Some syndromes are there, some pituitary hypothalamic balance may be altered in those cases, and said that Lawrence Moon Biddle Bardet syndromes, that hypothalamic hematomas and pituitary tumors that may lead to obesities. But most of the cases it may not be shown. Most of the cases only intellectual disability. I don't know, sir, the exact mechanism behind it, but probably the inhibition from taking food is lost. That may be one of the reason behind the intellectual obesity and the intellectual disability and obesity. Another spectrum is, sir, autistic spectrum disorder. In autistic spectrum disorder, particularly in those children with autistic, both in autistic spectrum as well as in ADHD, attention deficit hyperkinetic disorder. Those people chance of getting obesity is quite high. That might be because of their abnormal food habits, sir, because some sort of junk foods or easily available foods, they're very much fond of taking those foods apart from the homemade foods. That's why the intellectual disability, autistic spectrum disorder, and some exogenous sort of obesity, that those patients, children with long-term steroid therapy, particularly due to some neurological diseases, they may also be obese long-term after steroid therapy. So these are the common cases which we encounter in our day-to-day practice, sir.
एंड इसमें भी एक होलिस्टिक ट्रीटमेंट चाहिए, सारा कुछ इकट्ठा ही करना है और सब इलाज इकट्ठा करना है। बट वापस अपने टॉपिक पे चलते हैं। वी एक्नॉलेज द कमेंट फ्रॉम डॉक्टर योगेश विच इज समथिंग दैट आई वंडर डॉक्टर योगेश व्हाट योर एज इज, एंड द रीजन इज नॉट दैट वी आर टीजिंग यू, बट आई once Dr. Sovik shares his comments, then I would like to share my experience about melatonin and flupentixol. So Dr. Sovik, would you like to take this? Your experience with, so that's the question. What is your experience with melatonin and flupentixol over the past couple of decades?
Sir, this is probably the most common drug used used in neurology OPD, and our residents are use it rampantly because some sort of what I have said, sir. Because lots of somatic problems, somatization, somatoform pain disorder, where very low dose flupentixol and melatonin acts better, much better than any other drugs. But again, sir, that is the problem, that flupentixol is typical D2 blocker drug, so long-term use should be strictly prohibited, and that should be given with monitoring, strict monitoring. Otherwise, responses are good, though there is some controversy in the combination, that melitonin and flupentixol, and sometimes that quite a few times that is out from the market, but that basically act well in somatoform, somatization, and multiple pain symptoms without any organic correlates. However, that should be used strictly under strict supervision or guidance, sir. This is my take, sir. What is your experience, sir, please?
So it is exactly the same with a little bit more. So when I was a young resident, we learned how to use the drug. That time the originator molecule was available, which had been developed in Denmark. Now it is not available because the company discontinued their operations in our country. In the company, they discontinued their operations in India. So I used it very effectively. When we would speak with our colleagues in psychiatry, they would laugh at us. But then the point is, if somebody has major depressive disorder, the patient is not going to come to me or even to Dr. Somik. The patient will reach the psychiatrist. So psychiatrist is treating major depressive disorder. What we are treating in our OPD, Dr. Yogesh, Dr. Sovik and I, what we are treating is depressive symptoms. So this drug was working very well. Then I was part of a couple of guideline writing. This would be around 2 decades ago. And then when I mentioned that I'm using this drug, my colleagues in neurology and psychiatry, again, they laughed at me. And they said, Doctor साहब आपने latest किताब पढ़ी है क्या? अब इस दवाई का नाम ही नहीं है in the latest Goodman Gilman. So when I was a student, it was there in the book. When I became a consultant, it went out of the book. So, so then I stopped. But then after a couple of years, I realized that there was actually a need for this drug. The more potent or the kind of guideline-based anti-psychotropic drugs were not necessary in my OPD. And I do keep on using this drug. And short-term, long-term, medium-term, all sorts of use are there. So, Dr. Yogesh, I would recommend that you keep on using the way Dr. Sovik is saying with vigilance.
Much less adverse effects, sir. Much less adverse effect. It's very low dose flupentixol, only 0.5. So that is very efficacious also. Very efficacious in low dose.
So, Dr. Yogesh, we don't have an answer for how many years you have in practice, but explain करने की कोशिश करूंगा to the doctors who are there. Like in infectious disease, sometimes you use a bactericidal antibiotic, broad spectrum, narrow spectrum. आप मरीज के हिसाब से चुनते हैं. But there are so many times when you prefer a bacteriostatic antibiotic. ऐसे ही आप इस दवाई को साइकोस्टैटिक दवाई समझें, just from a thought process, not a psychocidal kind of a medicine. And it's a very soft psychostatic kind of a दवाई. And अगर मरीज ठीक हो रहा है, उसका भला हो रहा है, तो keep on using. नहीं ठीक हो रहा है, then you
Exactly,
go
sir.
on to the more potent drugs.
Exactly so.
So we'll go on and a very interesting discussion going on now. तो सर न्यूरोसाइकाइट्रिक एस्पेक्ट्स ऑफ ओबेसिटी दैट इज आवर टॉपिक. तो ये तो बताएं सर कि व्हाट आर द न्यूरोसाइकाइट्रिक मैनिफेस्टेशंस, एंड अगर आप हमारी मदद कर दें,
Sir,
लेट्स ट्राई टू क्लासिफाई. हाँ, एक एक करके लेते हैं.
so for
न्यूरोलॉजिकल,
huh,
कॉग्निटिव, साइकोलॉजिकल, साइकेट्रिक, एक एक करके सर, वन बाय वन.
yes, sir. First, I have to, but the way I see obesity is that it's a simple. We should go with obesity. Oh, sir, for the purpose of convenience of our audience, I'm taking this O as oxygen O, and have two covalent bond. One end it's depression, one end it's anxiety. So it's O. You may take it as at empty canvas. Number second, B. B stands for, that is, body dysmorphic disorder. E. E stands for eating problem or eating disorder, like bulimia nervosa or anorexia nervosa. S. So A's have 5 prongs. First prong is that stress. Number second point, it's stigma. People start stigmatize. People starts discriminating, particularly in school. And this is very bad, sir. This is very bad. People start stigmatizing. That again creates stress. So poor stress coping, some sort of sleep problem that arising out of the obstructive sleep apnea at night. And studies also showed that some sexual abuse are also associated with obesity. And the last S is substance abuse. So I go that S with 5 prongs. That is stress, defective stress coping, sleep problem, sexual abuse, and substance abuse disorder. The T, I am taking it as that post-traumatic stress disorder. Means studies also showed that those obese people, those who have very less amount of stress coping ability or post-traumatic stress release capability. So that is T. And Y, we have a look towards the young. That young, particularly in children with obesity, with intellectual disability, and autistic spectrum disorder, with lots of affection, compassion, without stigmatization, and without discrimination. By this way, I look obesity, and I think, sir, I cover the entire spectrum of neuropsychiatric issues in association with obesity. Just, sir, OBESITY. That is O for what I am stating, depression and anxiety. B for body dysmorphic disorder. People have body dysmorphic disorder. People may have gender disorder. People may have poor self-esteem. E for eating disorder, bulimia and anorexia nervosa. S, I have told those 5 prongs. And T for that post-traumatic stress disorder and defective sort of stress management, defective coping. And Y stands for the young. We should have a look towards young children with obesity. And one thing I have missed one, that is I, obesity I. That I is impulse control disorder. Sir, one imagination or some research paper are coming that impulse control disorder, we have one important neurotransmitter in our brain without which we can't survive, that is dopamine. And that dopamine is the core of all form of addiction, starting from smoking, alcohol, and all sorts of addiction. And studies also showed that some sort of sweet and other sort of junk food will release excessive amount of dopamine. And excessive food intake or exogenous obesity, which associated with excessive food intake or junk food intake, that may be associated with impulse control disorder. That's why I'm including that I as impulse control disorder. This is my simple outlook on obesity for all the audiences, for better summarization or for better grasp. Sir, please tell what is your take on this.
ये
That
तो
explain
बहुत ही
all sorts.
परफेक्ट. हाँ, बहुत ही परफेक्ट और मतलब बहुत प्लेजेंट और परफेक्ट और बहुत सरल, बहुत आसान तरीका है, वेरी इजी वे ऑफ एक्सप्लेनिंग. एंड सडनली
That
वी रियलाइज दैट या ओबेसिटी, इस पे तो डॉक्टर साहब एक आर्टिकल छपना चाहिए एक बढ़िया जर्नल में.
sir,
बट वेरी
sir, if you
इजी.
think so, then I will write, sir.
Yeah, a very easy way of explaining all these various aspects. And इसको फिर paraphrase करते हैं, दोबारा बात करते हैं, तो obesity might impact the way you think, it might impact the way you respond to situations, and it also might impact the the response to therapy as well. So multiple चीजों में फर्क पड़ता है, और अकेले आप ही के साथ लिंक नहीं है ओबेसिटी, आपके जो सोशल इंटरेक्शंस हैं उसके साथ भी लिंक्ड है. So, sir, any examples from your OPD? Maybe today, maybe yesterday, a patient came with neuropsychiatric manifestations of obesity, और आपने उनको बोला कि ठीक है हम इलाज करेंगे, I am a neurologist, but you also need to lose weight. यदि आप वजन कम करेंगे, then the response will be better.
Sir, one very difficult case that first time I have to confess that first time I missed the diagnosis. Actually, the patient came 1 month back in OPD. I was only complaining that headache. Only complaint was headache, and I think that patient was obese. And I think that, and male patient, definitely male patient was obese. I think that's a IIH. It could be IIH. Though IIH is basically very common in female, still obese male, I thought that it could be IIH. But after evaluation, after eye movement checking, no sort of diplopia, no papilledema, then I went for MRI brain, and MRI brain was perfectly normal. Then next OPD, he came with another problem, multiple pain symptoms in an hair and hair dust. And then I went for detailed inquiry, and which I got, sir. I got that's a very mind-storming history that, but he has been criticized, he has been stigmatized in school by peers, and he was basically a victim of bullying in school, and since last 4 to 5 years. And some friend telling that is not looks like male, and he is harboring that sort of thinking in brain that I'm not looking like brain, and some sort of stigma. And now what the complaint he's basically have basically uh, is there is very distress inside in his mind, and he tells that I am not want to be male alone. I want not want to be male in my whole life, and I am now thinking that I am basically a female trapped inside a male body. So ultimately, it was a case of gender dysphoria presenting like this way, sir. It may be some form of environmental or peer stigma or peer bullying or like that, but these things should be dealt very carefully and sophisticatedly and affectionately, sir, which I think. And this was very critical experience in OPD last month.
So gender dysphoria actually बहुत common disease है. We think it is not common, but actually बहुत common है, and it might be missed in the endocrine OPD as well, because आप history जब लेते हैं तो बहुत ठंडे दिमाग से relaxed way में लेनी होती है. The patient should feel comfortable with you. You should feel comfortable with the patient, and the environment should be comfortable. तीन चीजें चाहिए. सुनने वाला जिसके कान है वो pleasant होने चाहिए, बोलने वाले में confidence होना चाहिए, और वातावरण भी ठीक होना चाहिए. With this thing, I'll take a comment from Akshay Diwan. Akshay, आपका point बहुत well taken है, and he says pornography and masturbation, do they have bad effects on neuroplasticity? एक तो कहूँगा ये question बिल्कुल जायज़ है, it is the correct question. दूसरा कहूँगा ये जिस मंच पे आपने पूछा, that is also right. आपका सवाल है about neuroplasticity of the brain, and it is the neurologist's responsibility to respond to that. So, sir, this question, multiple सवाल आ रहे हैं from a young man. Do these affect neuroplasticity in extreme, or if I remain in normal limits? And should I get rid of it? Can I get rid of it? What is the limit for watching TV, playing video games, and these things on social media?
Sir, again, this is another example of impulse control problem, or it's another problem of similar sort of repetitive stereotype behavior. This is basically impulse control problem, sir. And there is some problem over the our CSTC loop, that is corticostriatothalamocortical loop. That loop is very important. And frontal lobe, or what you have mentioned that in obesity also frontal lobe is gray matter, but In this sort of impulse control disorder, frontal lobe usually suppress those repetitive activities. So we should cultivate the way the power of the frontal lobe, which can effectively suppress this sort of impulse control disorder, and which I think that pornography watching and repeated masturbation, these are the kind of impulse control disorder. And one, if the power of the mind can be enhanced by means of the educate absolute training of the frontal lobe and the power of mind over body, that should be cultivated, so that one can have extreme sort of control over over his or her mind, so that this sort of repetitive impulsive behavior will be cut short, will be cut short down, in my
So
notion.
impulse control. Impulse control
It's
is the
impulse
key.
control.
Actually, yeah. And we can work on it. We can train ourselves. एंड जैसे बचपन में देखो, छोटे बच्चे को नहीं पता कि बाथरूम कब जाना है, टॉयलेट कब जाना है। मदर उसको टॉयलेट ट्रेनिंग करवाती हैं, वो बच्चा सीख जाता है। सो मेनी अदर थिंग्स, यू नो व्हाट इज टू बी डन इन सोसाइटी, व्हाट इज नॉट टू बी डन। तो इस चीज पे फोकस करते हैं एंड वी कैन कंट्रोल अवर इम्पल्स, एक एक करके कोशिश करते रहें इसकी। सर, a couple of questions from Dr. LVK Raju, who is a very senior ophthalmologist. He says bupropion, can we use this in depression and obesity?
Exactly, sir. So bupropion basically the drug which have lot of promise. Basically bupropion have the capability to control the depression as well as the impulse associated with it, and it has also the typical property to enhance the dopamine in brain. That's why in Parkinson disease with depression, where impulse control is a definitive problem, here bupropion is most effective. And number second is that the impulse control disorders that are associated with substance abuse problem like smoking, bupropion is very much effective in smoking cessation also. That's why in any patient, and bupropion doesn't cause much sort of weight gain. So where depression is associated with obesity, and that obesity again further is associated with impulse control intake of exogenous food much more, there I think bupropion would be a very, very good option. Sir, can you get it, sir? Hello, sir. Hello. Hello.
I hope I am audible now.
Yes, sir. There was some network issue, sir.
So thank you and apologies. Today has been a day of technical glitches. So now I think Dr. Sovik is able to hear me, but I am not able to hear him. But Dr. Sovik, if we have a few minutes more to go, if you can summarize for our audience obesity, neuropsychiatric manifestations of obesity. What should we be watchful of? If you can focus on the red flag symptoms and perhaps the red flag signs that we should look for in people in our family, people in our community. कौन से लोग हैं ओबेसिटी के साथ जो जीते हैं, जिनको हमें कहना चाहिए कि आप ओबेसिटी का इलाज जरूर करवाएं, क्योंकि इसकी वजह से आपका ब्रेन ज्यादा तंदुरुस्त होगा, आपका दिमाग ज्यादा शांत हो जाएगा. So the red flag symptoms and signs, and then also for someone with neuropsychiatric issues, any kind of anti-obesity medicines that we should promote, and others that maybe we would like to discourage or we would like to be more watchful about.
Sir, first thing is that depression in association with obesity, we should ask our near and dear ones and our patients for the consultation of psychiatrist. Number one. Number, when obesity is associated with binge eating or eating problem, then psychiatrist or neurologist opinion should be taken. Number third, that obesity in association with other neurological symptoms like headache, like double vision, like paresis, focal paresis, the consultation is absolutely essential. And the other part, that children with obesity, those who have intellectual disability or the victim of peer bullying and other social stigma, they should take opinion from psychiatrist or neurologist or endocrinologist. And your second question, sir, that the anti-obesity drugs, you are the better person to comment. But one thing I want to mention here, that the alternative medications and the rumors that this food will cause will help in mitigating obesity, like that should be sharply discouraged. And the endocrinologist opinion about the proper guidance of the drug, that is also very essential, because there are some sort of very important consideration that weight loss must not be too rapid. That may also indirectly
So
cause
again,
some
a
sort of
technical glitch. Perhaps we
neurological.
are not able to hear Dr. Sovik now, but Sabko, I think he's back. Yeah, carry on, sir.
Yeah. So that's why the important issues are if they at all have to take opinion, they have to take opinion from the endocrinologist for the purpose of using for proper use of the drugs, because in market there are some alternative medications, alternative foods like that, and these are much more problematic than helpful. So I think if you for our patient, if you need at all to have a good guidance, then you should consult your endocrinologist or physician, not to your like peers and others, and should search for, and must not search for any other alternative over the counter medications like that.
Thank you, sir.
Hmm.
सबको एक तो माफी चाहूंगा सबसे कि आज के हमारे टेक्निकल ग्लिचेस नॉर्मल से थोड़े से ज्यादा ही थे, सो वी अपोलोजाइज. वी हैव ट्राइड टू टेक क्वेश्चंस दैट वी कुड सी. कुछ हम जवाब नहीं दे पाए, परहैप्स बिकॉज आई कुडंट एक्सेस द क्वेश्चंस. पर डॉक्टर सोबिक को सर्टनली रिक्वेस्ट करेंगे कि दोबारा हमारे शो पे आए, एंड दैट टाइम वी विल मेक श्योर दैट द टेक्नोलॉजी इज बेटर. आज की
Okay,
जो गलती
okay.
थी मेरी तरफ से थी. आई एम आउट ऑफ होम एंड आई हैव लॉग्ड इन फ्रॉम होटल वाईफाई. तो गड़बड़ बस वो दिन होते हैं ना जब आई मीन लाइक
No,
वन
no
एरर लीड्स टू
problem.
अनदर लीड्स टू अनदर, सो ऐसे वाला था.
We'll do in other days also. Hmm.
बट डॉक्टर दुबे ने मंच संभाला, डॉक्टर दुबे ने समा भी बांधा. So he took care of the platform and he kept us engrossed, he kept us engaged. Dr. Sovik, we'd like to thank you so much. But pura thanks tab karenge if you come back again on the show and we'll repeat the topic again.
Okay, okay. Thank you very much. Thank you all for patient sharing and and to take part in our discussion.
Thanks. And we have Sriyan with us. Yes. So Sriyan, yeah. certificate of appreciation for you, Dr. Dubey. Thank you so
Thank
much.
you very much. Thank you very much. It's great for me. It's great.
To all those who have logged in, to all those who have logged in, shukriya, dhanyavad, mehrbani. In Haryanvi language, Dr. Dubey, there is no word for thank you.
No.
The closest that we have is thara bhala ho, which means may good be to you. And the answer to that is sabka bhala.
Basically, sir, I feel very much privileged to have this program with you, sir. My regards to you, sir. My regards.
So thank you, everyone, and we look forward to meeting you again next week on KK Med Talks. Jai Hind.